How is AFib then related to heart disease?
In a lot of patients with valvular heart disease, atrial fibrillation may be the first symptom they feel. They may come in because their heart is beating rapidly and will immediately feel that, and then as the evaluation is done, they'll learn they have a leaking valve or a tight valve.
Can you have a valve disease and not experience, we saw a great number of symptoms there. Can you not experience any symptoms at all, still have it?
Some patients may, in the early part of the disease, be totally asymptomatic and feel fine. I've seen several patients come into my office. I'll examine them and hear a very loud murmur and say, gee, do you feel any symptoms? And they'll really go up and down through several activities, say, I have no idea I have any problems.
Now, we do have a list here of risk factors that are very similar to coronary heart disease. Is it not fair to say that, I mean, a lot of these things are, again, we're back to a lot of those common sense issues here, but the one that strikes me right off the top is, again, the things that we talk about daily. You're watching your cholesterol, watching your blood pressure, don't smoke, be careful of being overweight or obese. I would say that for the doctor at least, these are the things that stand out every time you talk to a patient.
Exactly. These are same risk factors you have for a lot of other cardiac diseases and heart diseases. And these are just sure things that we all need to try and do in our daily lives to avoid any heart disease.
How do you then deal with the patients that will walk in when you see them with a lot of these or with some of these risk factors that you get so often? And again, I go to overweight or obesity because we are an obese society right now, and a lot of people still smoke. So what do you tell them? How do you talk to them when you first diagnose some of these conditions and know that that's what you're dealing with?
Well, first it's listening to the patient's history and getting their symptoms and hearing what's happening with them. And then taking a careful history and really talking to the patient about what's provoking their symptoms. And then as you work through the examination, listening to them, examining their heart, listening for murmurs, but then getting back to the basic things at the end of the examination, saying the most important things is to prevent heart disease, is to try and work on your weight, because even to do any intervention for any of these things, people who are very obese, it becomes more risky.